Are you trying to understand Medicare? We all know it can get confusing, so in this video, we're going to tell you about one of the 4 parts of Medicare, Part A. We're Shannon and Michael, the founders of Healthcare Genius. For the best information on healthcare and retirement, subscribe to our channel and click the bell to be notified when we come out with new videos.
Thanks, Shannon. So what is Medicare? We've been hearing a lot about Medicare for All in the media during the presidential campaign, but the Medicare we're talking about is for those people who are over age 65, in most cases. There are 4 parts to it. There's Part A and B, which are the parts of original Medicare. Then there's Part C, which are Medicare Advantage plans, and Part D, which basically are prescription drug plans. Part D came about during the Bush administration. Today, though, we're going to really focus on Part A and what that means. A lot of times people think of Part A as hospital coverage.
So what exactly does it cover? The first piece that Medicare Part A covers is inpatient hospital care. So from the day that you are admitted to the hospital and you need to be treated in the hospital till the day that you get out, in most cases. But it doesn't always cover everything. So some of the pieces that it doesn't cover are really anything that's not medically necessary. So we had a client, for example, who needed to have somebody in the room with her at all times. And she had to have a nurse in the room with her at all times, and it was medically recommended by her doctor, and so that was covered by Medicare. But if it's not required by your doctor, most times it's not, you don't get certain luxuries like your very own hospital room or your own private nurse. Also, some things that people don't always think about is things like a razor or shampoo or TV or phone. Again, those things that aren't medically necessary for you to be in the hospital, you probably will be subject to paying for those things.
Yeah, I guess you're probably not going to get a suite and a butler service at the hospital, right, Shannon?
Unfortunately not. The last piece that I wanted to touch on is there are some restrictions when it comes to blood, so if that's something you need while you're in the hospital, it may or may not be covered.
Great, thanks, Shannon. Another thing that comes up is, are there coverages under Part A when you need care at the home? I can talk about this personally. My mother had a hospital stay, had to then go to a rehab center and came home, and Medicare actually paid for some of the coverages that she received when she was at home. She had to have some physical therapy done, some speech therapy. She had lost a little bit of her speech, and so we had people come in and do that. There was some emotional counseling, some social counseling that also came in. So those are some of the things that were covered when she was at home after she had left the rehab facility that she was in. Now, it doesn't necessarily cover everything, though. So for instance, she wouldn't have been able to have 24-hour care in her home if she needed that. That's not covered under Medicare Part A. The other thing to remember in all of this is that you have to have a doctor's authorization to do this. So you can't just decide that you need to have this care. A medical doctor is going to need to sign off and make sure that it is medically necessary.
So the next thing that's covered under Medicare Part A is a skilled nursing facility, but there are some stipulations. It must be following at least a 3-day hospital stay. So if you have to be in the hospital for illness or for an injury and you need to go to a skilled nursing facility after that, that's covered by Medicare. Also, a lot of the things that you might need while you're there, whether it's medical equipment or drugs, that's one of those cases where that actually is covered by Part A. Now, what's not covered is that if your doctor doesn't determine that it's needed. And the other part is if you need these services but they're not tied to a medical event, that's not covered by Medicare. So for example, for folks that are getting older and need to go to a nursing home, that's not covered. It's only when it's tied to that medical event.
That's great. Thanks, Shannon. So hospice care, another area that obviously as people age becomes very important. So to understand how Medicare Part A covers hospice care, you need to know that, first of all, it's going to require a terminal illness. How Medicare defines that is typically less than 6 months to live. So if you or a family member has less than the 6 months, then you would potentially qualify for hospice care. It can be done in the home or at a facility. So those normally you have those options. It is going to be palliative care. So the idea behind hospice is not that they're going to treat you for your particular illness, but they're going to make you comfortable. And that'll be through a combination of just care and having people there, as well as using medications. So hospice care is definitely something that is covered under Part A, but again, as we've talked on all of this, you're going to need to make sure that a physician is authorizing that or making sure that it's medically necessary.
That's right. And one thing to just keep in mind outside of hospital services, whether it's hospice care, a skilled nursing facility, it has to be a Medicare approved facility or service.
Is Medicare a little more restrictive than you thought? Please leave us a comment below.
Okay, so now what we want to talk about is the cost of Medicare. Now, a lot of people come to us
Wait,
and they...
Shannon, I thought it was free.
Exactly. A lot of people come to us and they say, oh, isn't Medicare free? The short answer is no, but Part A is actually the one piece of Medicare where, as long as you've worked in the United States for at least 10 years, which is for most Americans, it doesn't have a premium. So you don't have a monthly amount that you're paying for Medicare Part A when the time comes that you need it. However, there are still some costs associated, which is what a lot of people forget. There's actually a deductible that's associated. So for example, if something happens to you and you have to go to the hospital, there's an amount of money that you have to pay before your benefit starts kicking in. So once you hit that deductible, then from days 1 to 60 that you're in the hospital, Medicare will cover the rest of that amount. Now, it changes a little bit once you get to day 61. If for whatever reason you're still in the hospital from day 61 to day 90, there's a small amount of money that's called a coinsurance that you have to pay every day that you're in the hospital from day 61 to 90. So if you're still in the hospital after 90 days, one of two things can happen. One, you may have some lifetime reserve days left, which you only have 60 of, and if you get past that coverage amount, there's a coinsurance for each day that you need those reserve days.
And Shannon, that's why our clients are always asking us, do we need other coverage than Part A and Part B of Medicare? And the answer is, for most people, yes, because those coverages are going to run out and you're going to want something on top of that. So when we talk about Medicare Advantage plans, Part C, or Medigap or Medicare supplement plans, those are the plans that are going to help you pay for coverages if you happen to run into those longer hospital stays. Mm-hmm. And we'll talk about those in more videos.
That's right. Yeah, unfortunately, once we get to a certain age, those long hospital stays aren't that uncommon.
People are always asking us, when are they eligible for Medicare? It is complicated. Normally, 3 months prior to age 65, you start getting mail from the Social Security Administration and Medicare that you can start to sign up. So age 65 for most people is when they're going to sign up for Medicare. There are some exceptions when you have certain illnesses like Lou Gehrig's disease or ALS or end-stage renal disease, then you can qualify for Medicare prior to 65. Also, if you're on Social Security disability, there's the ability to get Medicare prior to age 65. But for most of us, it's going to be age 65. Now, you don't have to sign up at 65 if you're working for a large employer. We'll talk about that in some of our other videos, but that's normally who is eligible. Obviously, a U.S. citizen, as Shannon mentioned earlier.
Mm-hmm. And then when you do sign up, your eligibility starts, so you can start receiving benefits the first day of the month that you turn 65. So if you turn 65 on May 15th, as long as you've signed up in the right time frame, your benefits will start on May 1st.
That's awesome, Shannon. I only got 9 years, and then I'm golden. Another thing that people ask us is, how do you sign up? Well, really three basic ways. One is to call the Social Security Administration and sign up for Part A and B. You can also go down to the Social Security Administration and in person. Sometimes it's not busy, sometimes it is, so you may want to check that out. And then third, you can go online and sign up for those coverages. But it's important to understand you can't do any of the supplemental plans or the Medicare Advantage plans that we'll talk about without having Part A and B first. So just know that's really the first step for you to be able to sign up for supplemental plans.
That's right. And additionally, if you're receiving Social Security checks, you automatically have to sign up for Part A to receive those Social Security benefits after 65.
Yeah, that's right, Shannon. That's a great point, because a lot of our clients, when they're working for larger employers that are 20 or more employees, feel like they have to sign up. You don't necessarily have to sign up for Medicare until you retire, with that exception of taking Social Security, then you have to sign up for Part A.
That's right. So whether you're ready to sign up for Medicare today or you have some time and you just want to plan ahead, feel free to click on the link in our description below to become our client, and make sure you subscribe to our channel and click the notification bell to be notified when we come out with new videos.